tonight at 11. Their futures are on hold.
Now I'm getting angry and disgusted. Really, I am.
Hear from those getting bumped from surgery to make room for more COVID patients. Then, new options open up as demand for COVID testing climbs. Plus, a big setback for a popular Portland restaurant.
Why? What is going on, with our lives right now?
And a Beaverton athlete goes for gold at the Paralympics. Thank you for joining us for KGW News at 11 o'clock. I'm Laurel Porter. All across Oregon and Southwest Washington, thousands of people are getting phone calls and learning the surgery they've waited months to get is canceled. They're being canceled because the hospitals are full, mostly of unvaccinated COVID patients. Our Pat Doris spoke with some of those people growing frustrated by the delay.
Oregon's major hospitals do hundreds of surgeries a month in normal times, but of course these are not normal times. Hospital space is tight and reserved for emergencies and COVID patients. That means people like Paul McElhenney, a school bus driver who lives in Tigard, has to live with his knee pain.
My knees are totally bone on bone, kneecap bone, so that's what's tough.
His knee replacement surgery is on hold. Christy Finn of Milwaukee needs surgery on her stomach.
But basically, my stomach is dead. And so they're going to have to remove it. And I've been on a feeding tube since April. I can't have any solid food. It's all got to be liquid.
Her surgery also on hold. She's losing her sympathy for those who will not get vaccinated. The majority of people currently hospitalized in Oregon for COVID are not vaccinated.
I'm frustrated. It's all could have been, it's preventable. It's preventable. I mean, at first I was very sympathetic and I'm sorry that people are sick and that they're dying, but there's others of us out there that I'm immunocompromised. I mean, I have other conditions going on.
Barb Russell in Central Oregon has a racing heart. It's called AFib.
AFib is when your heart beats irregularly and the blood then coagulates into the atrium. Then when the heart finally calms down and gets back to normal, it can pump out blood clots. And those can cause strokes, death, whatever.
Her procedure also postponed until, well, she's not sure when. After the COVID surge quiets down, probably.
Yes, it upsets me that people are protesting, don't get vaccinated, don't wear masks. Well, I'm sorry, you're messing with my life. So I'm bitter.
You are probably noticing a pattern here, and truthfully, we could keep going. Melanie Johnston from Cornelia spent 2 years searching for a solution to her lower back pain. It was going to be surgery until it wasn't. And Sherry Young, who needs a hernia operation to relieve her pain. When you hear about elective surgeries, this is what we're talking about. They are 5 of thousands around Oregon, suddenly shut out of surgeries that would relieve their pain and suffering, the victims of others' choices, and they are not happy.
I feel I've done everything right.
The pain is impacting my life.
It's preventable.
People are just not educated on the situation.
It seems like it's impossible. I don't know. It is frustrating.
The hospitals are cutting back on the surgeries because in some cases the patients would need to recover for a night or two and there's no room. Some day surgeries are also canceled because those recovery rooms are being used for COVID patients. And even where there might be an open bed, there are not enough nurses and other medical workers to care for the patient who would be put in that open bed. As the days go on, desperation grows for some. In Sisters, Oregon, Gerald Schoaf just hopes he can keep walking. He has MS and his spine is degenerating.
There's multiple surgeons, and they're going to go in my front, my back, and my side.
He's been active most of his life, but now with his surgery delayed, he's terrified of ending up in a wheelchair.
Definitely, yes.
It's the sort of future that can move a strong man to tears.
Sorry, I get emotional about it. It's frustrating, though.
He has seen the protests against vaccinations and people proclaiming it's their right to skip the COVID shot. But he's also felt the impact of those personal choices, which now have delayed so many surgeries, including his. And he is out of patience.
Early on, I was kind of passive. Now I'm getting angry and disgusted. Really, I am.
And you can see why people are so frustrated. That was Pat Doris reporting. And we do have a happy update late today. We got an email from Gerald's daughter. He'd called his doctor to ask some questions and mentioned that he'd done an interview for us. And guess what? They called him to the hospital today to get prepped for his surgery. And we wish him good luck. New tonight, we're also following breakthrough cases in the state. The Oregon Health Authority just released its new report. Cases of COVID-19 are still far more common in unvaccinated people. This chart shows the rate of COVID-19 in unvaccinated people is currently about 5 times higher than in vaccinated people. Over the past week, 15.9% of cases were in people who are fully vaccinated. As for hospitalizations, they dropped, with 47 fewer people receiving care in a facility today compared to yesterday. In total, there are just over 1,100 hospitalizations, and 308 of those people are in the ICU. Right now, our area is seeing increased demand for both COVID testing and the vaccine. And that means officials are finding new ways to make that more convenient for people. Catherine Cook has a look at the latest efforts to meet both needs.
In Astoria, people signed up for a different kind of mobile vaccination clinic.
We're offering free urgent dental care to those in need as well as vaccinations. So it's kind of a unique little program, but if it gets people out to consider vaccinations, we want to do that.
Cindy Briel with Medical Teams International is executive director of U.S. programs. The nonprofit is hosting a series of coastal vaccine clinics sponsored by Kaiser Permanente Northwest. They'll be in Seaside Friday. Right now in Clatsop County, 61% of the total population is vaccinated, compared to 68% in Multnomah County. It's one reason they're reaching out.
Just the lack of services that are there for people. And so you could even call some of the towns healthcare deserts because there's just not enough care there.
In Gresham, the county hosted a vaccine clinic that also brought holdouts.
Well, because they were offering the free gift cards and stuff as an incentive, so.
We can't take you inside, but the lines stretched out the door. Incentives or not, many vaccine holdouts are having a change of heart or feeling obligated due to mandates. Demand for COVID-19 testing is also growing. In response, OHSU Health will open a medium-sized drive-through testing site at the Portland Expo Center next week. Testing will be free, but by appointment only.
There's still a need for testing.
Briel says Medical Teams International will also make testing available at select vaccination sites. She hopes those still on the fence about getting the shot will recognize what's happening soon.
We're displacing other people who need care because of the amount of COVID in our hospitals, that's concerning.
Catherine Cook, KGW News.
Some healthcare workers around the Northwest have been protesting the vaccine mandate. All these shoes belong to unvaccinated healthcare workers at Riverbend Hospital in Springfield. They're fighting the mandate that requires them to get vaccinated or lose their jobs. The hospital's deadline to comply has passed, so they left their shoes at the entrance to mark their last day at work. The Oregon Nurses Association says it's trying to help more than 100 unvaccinated nurses figure out their next steps.
Individually, our labor representatives are meeting with each person who has been placed on unpaid administrative leave to find out exactly what their situation is.
Riverbend says the vast majority of its staff, 91%, is fully or partially vaccinated. The new school year is either in full swing or just about to start. And in recent days, we have heard from concerned teachers about having so many kids back for in-person learning. One teacher sent us this photo taken at a Portland Public High School between periods. A Portland Public School spokesperson says these types of crowds dissipate quickly and the district will address issues as they come up. There's that picture there. We asked a couple of doctors for their take. Dr. Smitha Chidaga has 2 kids starting in-person school next week, and Dr. Erica Meyer is a pediatrician and former teacher. They say safety protocols like mask wearing are absolutely necessary, but nothing's perfect, and we should expect to see some cases in schools.
And if we try to expect it to be perfect and expect there to be 0 cases, then we're not really facing what the reality is.
You know, just this week, the number of pediatric cases is up 9% compared to last week. You know, in other areas of the country that have schools starting earlier than us, There are tens of thousands of kids who are quarantined.
They say anyone who is eligible should get the COVID-19 vaccine to protect those who can't get it right now, like children under 12. As we approach Labor Day weekend, many people will be hitting the roads and causing a lot of traffic for drivers. The Oregon coast, how beautiful, will probably be the most popular destination, while others will be heading to Central or Southern Oregon to sites like Crater Lake. If you haven't booked a room yet, Travel Oregon's Allison Keeney says good luck.
I would suggest, calling hotels directly might be the best way to try to snag a last minute hotel. But, hopefully we've been telling people to plan ahead. So hopefully most people have done that already.
Travel Oregon also has some good advice for all of us. Be kind and patient, especially to frontline service folks at restaurants and hotels working under pressure. And when it comes to COVID, be aware of the mask mandates and socially distance from strangers. Lastly, keep hot cars off dry grass to help prevent wildfires in these last days of summer.